Diseases of the respiratory system. Respiratory diseases are those which affect the breathing structures and make gases exchange in animals difficult. There are many and varied, but we look at a few in this lesson. Starting with asthma. Asthma is an immunological disease resulting from an allergic reaction in the body. That is, it comes about as a result of the immune response. The body reacts to foreign particles in the air, such as pollen grains, atmospheric dust, animals' fur, scents from certain drugs, foods, and even flowers. So the body reacts by the contraction of bronchioles. The presence of these substances that stimulate the immune response causes an allergic reactions along the respiratory tract, and the commonest site is the bronchioles. So the bronchioles contract. You can see in this diagram here, this is a normal bronchiole where the lumen is quite free and there is free passage of air. But in an asthmatic bronchiole, there is contraction of the walls which will impede the smooth flow of air, resulting in panting, wheezing, and the patient feels suffocated. In some cases, this allergic response may be precipitated by emotions such as anger, fear, anxiety, and frustrations. Asthmatic attack may also be brought about by infections by certain bacteria or viruses. Now, in some cases or in some people, certain weather conditions may also bring about an asthmatic attack, and the person affected may have difficulty in breathing as a result of the contractions of the bronchiole. Now, the only way to treat and control asthma and prevent its occurrence, in some cases, one is by spraying of a muscle relaxant directly into the bronchial tubes. When the person gets an asthmatic attack, they use an inhaler which provides chemical substances that relax the muscles along the bronchial tubes, thereby opening them up. Or if not that, injection of drugs or oral application of certain pills may relax the muscles along the bronchial tubes, thereby opening them up. Or lastly, if the person knows the factors that precipitate the asthmatic attack, be they allergens, emotional conditions, or certain weather conditions, then they are best advised to avoid these causative agents. The second disease of the respiratory tract system is bronchitis. Bronchitis refers to the inflammation of the bronchial tubes. See here, the normal bronchial tube with an open lumen and one in which the walls have been inflamed such that there is no longer any free passage through them. Now, there are two forms of bronchitis, namely there is acute bronchitis and chronic bronchitis. Now, the acute bronchitis is quite common in children and is caused by two main factors. One, complication of a common cold when one is exposed to low temperatures, especially in high altitude. It results into the chilling of the body, giving way to bacterial infections. These bacterial infections then lead to swelling or inflammation of the bronchial tubes. Secondly, it could result from a complication from a previous disease attack, for example, if it is whooping cough or flu. Now, the symptoms of an acute bronchitis include headache, mild fever, coughing, and generally an uncomfortable feeling behind the sternum or the breastbone. Now, the illness may clear in a few days or may persist for several months. So acute bronchitis sets in abruptly, and the symptoms are quite clear and observable, and it may clear within a few days. Then the second type is the chronic bronchitis. Chronic bronchitis develops after several repeated attacks of acute bronchitis, and it may develop into another complication known as emphysema. The chronic bronchitis usually affects the lower respiratory tract, and it is caused by irritants such as dust particles or certain gases such as sulfur 4 oxide. Particles in cigarette smoke may also bring about chronic bronchitis. These factors cause inflammation of the bronchi and bronchioles, thus stimulating increased mucus production. So you can see there's mucus production here in the case of chronic bronchitis. This excess mucus clogs the air passages, resulting in persistent coughing and difficulty in breathing. So these are the clinical symptoms of chronic bronchitis. Now, because of the difficulty in breathing, if not treated, it may be fatal because it makes the sufferer unable and unfit to work or to move around. Or, in fact, it may make it so difficult for the person to walk or sleep unless they are propped up in bed to ensure that the bronchial tubes are not clogged by the excess mucus. Now, when the condition continues, with the smaller bronchioles becoming plagued with mucus, coughing causes sudden increase in air pressure within the alveolar sac that is connected to the bronchioles. This pressure ruptures the delicate walls of the alveoli. See, this is a normal alveoli sac, but because of forced coughing to get rid of the mucus that are clogging the bronchioles, the delicate walls of the alveoli sacs are destroyed. So you can compare these damaged alveoli with the normal one. In the normal, you can see the alveoli are complete with the walls partitioning them, and they are roughly spherical. But in the alveoli with emphysema, the walls are collapsed. So this greatly reduces the effective surface area for gaseous exchange. And patients with the emphysema have difficulty in breathing. They grow weak, tired out very quickly, even from very simple exercises such as just walking around. Now, treatment and control. Patients should seek early medical assistance when the illness is still in its early stages. That is, when they observe the symptoms mentioned, such as the difficulty in breathing, excessive mucus production, and so on. They should seek early medical treatment. Otherwise, there is no treatment or there is no drug for curing chronic bronchitis and also the acute one. However, if the patient avoids smoky and dusty places and refrains from smoking if they are smokers, then the disease will cure itself with time. Likewise, there is no cure for emphysema. The patient should refrain from smoking and avoid dusty and smoky places. Antibiotics may be administered to prevent bacterial diseases such as pneumonia that may infect the already weakened body tissues. Third disease is whooping cough. Whooping cough results from an acute infection of the respiratory tract by the bacterium known as Bordetella pertussis. The symptoms of this disease, which is quite common in Kenya, include prolonged coughing and vomiting, conjunctival hemorrhage, that is a bleeding through the conjunctiva of the eye, convulsions and even coma, ulcers and cardiac failure or complications, especially in children. Malnutrition signs for protein and energy deficiency due to repeated vomiting with difficulty in feeding. So children do not feed normally. If they cannot feed normally, then they tend to show symptoms of malnutrition. Treatment, there are two ways. Complicated cases should be admitted to hospital for specialized care and administration of antibiotics. And secondly, the patients should be fed on a balanced diet. But the best way to control whooping cough is to immunize the children at an early age. In fact, vaccination against whooping cough is one of the mandatory vaccines that children must get early in life. Then, fourth disease is known as pneumonia. Pneumonia is an inflammation of the lungs caused by infections by a variety of pathogens. These pathogens include bacteria known as the Streptococcus pneumoniae and Mycoplasma pneumoniae. Symptoms of attack of pneumonia occur after a short incubation of period, followed by coughing, fevers, chest pains, and deposits of fluid in the lungs. In this illustration here, see the normal alveoli is quite clear, but the one that has pneumonia has thick layer of mucus. That is the body's response to infection by bacteria. Now, the attack proceeds from the throat usually and spreads to the other parts of the body. It begins from the throat and can spread to the deeper lower part of the respiratory tract. Now, treatment involves the use of antibiotics, which include penicillin. Otherwise, control involves 1. Avoiding overcrowded places with poor ventilation, because that makes it easy for the bacteria to be spread around. And 2, provide good ventilation in living premises or working premises to avoid spread of the bacterium. Then there is pulmonary tuberculosis. Pulmonary tuberculosis is a disease that affects various organs. That is, tuberculosis in general is a disease that affects various organs, including the bones, the skin, kidneys, intestines, and also the lungs. So the specific tuberculosis that affects the lungs is known as pulmonary tuberculosis, which is caused by the bacterium Mycobacteria tuberculosis. Tuberculosis develops slowly and requires a long period of treatment and cure. Symptoms include general weight loss of the body, coughing, sometimes with sputum that contains blood, chest pains, fever, and loss of appetite. The bacterium is transmitted through inhalation of infectious materials such as dry sputum or droplets expelled during a cough. It is also transmitted through consumption of milk and milk products from infected cattle. This is another variety of the bacterium known as Mycobacterium bovis. Mycobacterium bovis that also causes pulmonary tuberculosis in human beings. So this can be contracted from infected milk and milk products. Now, this bacterium destroys lung tissues, making it hard for the patient to breathe. And if not treated, it may eventually result into death. Treatment involves the use of antibiotics such as streptomycin, and tuberculosis can be controlled in the following ways. 1. Through early detection in its early stages, followed by treatment, immediate treatment. 2. Pasteurization of milk. 3. Vaccination of the population. And 4. Avoid close contact with infected people. Avoiding close contact with infected people. And then lastly, lung cancer. Lung cancer is an uncontrolled cell growth that occurs in the lung, because cancer generally refers to an uncontrolled cell growth in the body resulting in the tissue tumor or enlargement. So lung cancer is that type of growth that occurs within the lung. Now, the growth can only affect a single point within the lung or may affect other parts of the body when the cancerous cells break away and spread to other parts of the body. So in this illustration here, we see here this is a cancerous growth affecting one part of the lung. So this growth may just be confined to this particular part. In that case, the growth is said to be benign. But if the cancerous cells break away and spread to other parts of the body, then the tumor or the growth is said to be malignant. Now, there are no specific causes for lung cancer, but there are those factors and conditions that are associated with the disease. And these include smoking. Cigarette smoke contains certain substances known as carcinogenic substances that can trigger uncontrolled growth of the lung cells. Apart from cigarette smoke, there are also other substances such as asbestos dust, radiation such as X-ray, gamma rays, radioactive substances such as uranium, and certain gases such as mustard gas that can also trigger uncontrollable growth of the lung cells, resulting in lung cancer. Lung cancer destroys the lung cells and tissues, and as a result, this interferes with the free exchange of respiratory gases, which may eventually lead to death. Treatment for lung cancer may include 1. Surgery to remove the tumor. 2. Radiotherapy to destroy the cancerous cells. 3. Chemotherapy to relieve the patient of pain and also to destroy the cancerous cells. 4. The use of combination of several drugs, each which is toxic to the cancerous cells, to enhance the treatment program. That is, by destroying the cancerous cells, you allow the organ and the body in general to recover and respond to the treatment program.